Do you have elbow pain that's affecting your daily life? Perhaps it's bothering you at work or in your recreational activities. Did you know that your elbow has 3 separate joints, 15 individual muscles that are responsible for 8 motions at both your wrist and your elbow? I know you have elbow pain. The question is, what's causing your elbow pain? My name is JR. I'm a doctor of physical therapy and a certified strength and conditioning specialist. And today, right now, I'm going to go through with you some simple tests that you can do to identify the most common cause of elbow pain. The first thing we need to do is make sure that you are able to fully straighten and bend your elbow. If you're not able to fully straighten or bend your elbow due to severe pain, large amounts of swelling, or perhaps your elbows are misshapen, they don't look similar on your right and your left, you need to stop this video and you need to go to your nearest urgent care or contact your physician. You may need immediate medical attention. If you're able to fully straighten and bend your elbow, then let's dig into the most common cause of elbow pain. This common pain is found on the inside of your elbow medial or the outside of your elbow, which is lateral. This pain comes on gradually over time and is due to repetitive motions. This is an overuse or an overload injury to the tendons of the elbow. Does it hurt to hold a morning cup of coffee, shake hands with a friend, or lift something heavy, or maybe even lift something light many times? These are all signs of elbow tendonitis. Let's figure out if you have elbow tendonitis. The first test that we're going to do is I'm going to have you hold your hand straight out in front of you. Your elbow will be straight, your wrist will be straight, and your palm will be down. You're going to take your opposite hand and place it on your middle finger. You're going to try to push that finger towards the ceiling. If this causes pain on the outside or the lateral portion of your elbow, this could be a sign of tennis elbow. Tennis elbow on the lateral side of your elbow. The other test we can do for lateral tendonitis, or what we call lateral epicondylitis, which is also called tennis elbow, is you're going to hold your arm straight again. You're going to put your palm down. This time we're going to make a fist. We're going to bring the wrist back. You're going to take your opposite hand and you're going to place it on the back of your hand and you're going to push against your wrist. If this motion causes pain on the outside of your elbow, this is another sign of lateral epicondylitis or tennis elbow. Now for golfer's elbow or medial epicondylitis, what we're going to do is we're going to put the arm straight. We're going to put the palm up this time, facing the ceiling, make a fist, bend the wrist back. We're going to push against our hand. If that causes pain on the inside of your elbow, this could be golfer's elbow or medial epicondylitis. Now we know that you have golfer's elbow or tennis elbow. So what are we going to do to fix it? The most important thing you can do when treating yourself for lateral or medial epicondylitis is to avoid painful activity. When we do activities that cause pain, our body is telling us that we're causing micro damage to these tendons. That's why we get pain. So in order for us to heal, we have to stop doing micro damage. Now, some of you might be saying, well, my job hurts, or it hurts to take care of my children, and I can't stop doing that. Well, that's where we come into stretching, icing and heating, and bracing. And also, I want you to really think about what causes your pain, and perhaps you can do it a different way. You can use your opposite arm, or maybe you could do something a little different in your job that doesn't cause pain. It is important that you avoid these painful activities. What I've done is I've put together a step-by-step guide to walk you through the process of recovery from lateral and medial epicondylitis. I have the pictures of the tests again so you can retest yourself. I have stretches, we walk through bracing, we talk about icing, and we also talk about strengthening. The biggest mistake people make is when their pain goes away, they stop their exercises. They stop stretching, they stop strengthening. This is a mistake because it is important to strengthen your muscles after an injury to prevent further injury. 50% of injuries that come into my clinic are second-time injuries because people stop doing their exercises, went back to their activity, and their pain returned. In this free walkthrough guide, There are step-by-step examples of exercises you can do to keep your arm getting stronger that'll keep these injuries away. And again, it's also important that you look at your life and figure out what activities are causing your pain and that you modify them. To get this free step-by-step guide, all you need to do is put your email address below and we'll email you this whole guide on how to get rid of your pain. We don't solicit emails, we don't sell emails, it's just to give you this information to help you get better. So please send the email below, we'll give you the guide, and we'll get you on the path to recovery.